There is a lot of work to do here to improve the healthcare on station. 2 months ago, a silent march was organized because people were very concerned about the death of a citizen. And my sympathy goes out to the family, to friends and everyone involved. And my staff is working with stakeholders on the island on a short-term agenda to improve healthcare on station. Together with the hospital, we need to improve the primary healthcare services on station themselves. And I share the ambition of the supervision board of the Healthcare Foundation that station needs a well-equipped, modern primary healthcare clinic. And I'm pleased that the interim director, Mr. Frank Rottweiler, is actively working on the essential improvement with us. And we need to improve our medical referrals. It is my ambition to organize referrals more patient-friendly. We have agreed that we will start a pilot this year that the GPs on Statia and Saba can refer directly to St. Maarten Medical Center without the formal consent of the medical advisors of the ZJCN office at Bonaire. We have also agreed with SMMC that they will improve their services for patients of Statia and Saba. An example is that patients should be able to have several appointments with specialists during one visit instead of several visits. Of course, it is also important to look at our own services provided by the people of VWS, of ZJCN here on station. We can do better. We need to improve and intensify our communication with the people on station and be more open to suggestions of the people of station. Recently, my staff had special complaint walk-in sessions. And because we think this was a success, we will organize